Good morning. Welcome to Healthy Happy Hour. I'm Angela Berg here at Care for the Kids Foundation. And with me today, I have Erica Bailey, our extraordinary infection control and compliance nurse. And thanks for being with me today.
Thanks for having me.
I think that we're in a really important time of year as we're getting ready to go into cold and flu season. And every year since COVID, we kind of don't know what to expect and have had a kind of a roller coaster every respiratory season since. So I want to make sure that we talk about some of the ways to protect ourselves and protect our family. And I couldn't think of a better person to ask than have you with me here today and talk about the importance of some of those preventive things to think about. So let's start with just talking about what do you think is the number one most important prevention thing that people can do to protect themselves from getting the cold and flu this season?
Yeah, excellent. So number one thing any of us can do is to wash our hands. Getting some good soap and water with warm water, 20 seconds, or even a hand sanitizer can do wonders for all of us for infection prevention. So we cannot stress it enough how important that is.
So let's talk about, because I think people have gotten so used to carrying hand sanitizer since COVID, but there are times when hand sanitizer is not enough. So if somebody has returned to their old habit of straight into the hand and you actually get wet or get secretions on your hand, is it okay to just do hand sanitizer?
You know what, I would say that if that's all you have, it's better than nothing. But if you're near a sink, nothing is going to replace a good hand washing. For any time your hands are visibly wet, dirty, you don't want to keep rubbing in that wet, whatever it is. Just a good old-fashioned hand washing is the best way. Hand sanitizer would be a follow-up.
And then I would say too, one of the best lessons we learned out of COVID was about coughing and sneezing into your elbow. I've even seen kids who are so flexible here at the clinic they can do it into their armpit. Right. I can't quite do that.
No, me either.
But going into that elbow is a really good way to make sure that you're protecting. What is the statistic about how far that spray can go when you actually cough or sneeze and don't cover?
You know, most of the general knowledge is about 4 feet, but I have seen some studies that take it up even further, that it could be 6 or 8 feet on certain circumstances if the wind is right and the airflow. So, you know, it definitely is a spray of germs and bacteria that's out there.
Yes, yes, indeed. So another thing is that there are many of us, myself included, who are not a great fan of wearing the masks, because I feel like I've gotten free face now since we got through the pandemic, and now I'm like, I don't want to wear a mask. No. Will you talk about, kind of from an infection control point, when is the right time these days to wear a mask? Because even here in our clinic, you'll see some staff with masks and some with not, because we follow infection control guidelines and self-regulate a lot of that. So will you talk a little bit about wearing a mask and when you should, and when you should out of kindness to others?
I love how you said that. That is so true. So sure, I mean, it is, masks. I mean, I can't think of anyone who loves to wear them. But if you are starting to feel what we call viral symptoms, which are those cold symptoms, you feel achy, you've got a tickle in your throat, you're starting to cough, or runny nose, if you're going to be around others, we really should encourage mask use. And that prevents that spray, that prevents things just getting out there and coming on other surfaces, and just prevents the spread. Because after hand washing, which is the best prevention, the second one is making it not happen to begin with. And so a mask will control those droplets that are even coming out when we're just sitting here talking. So it is very important. If you're in your own home by yourself, probably not as important, but if you're going to be out in public, we really encourage the masks.
Sometimes you might even think that it's just allergy symptoms, for example. And if you're not sure, if you've been around people who've been sick, it's just a kind thing to do to wear a light mask so that you're decreasing the viral load that you're spreading around to everyone else. I like that.
That's a great point.
How about when people see people in our clinic with a mask A lot of our viewers are our own families. Should they be alarmed or concerned if they see mask use in our clinic?
No, that is fantastic. I do get that question a lot, and they absolutely should not. It's just that particular caregiver's personal way that they're going to prevent whatever they are feeling. Is it allergies? Is it a cold? I don't know, I'm going to wear a mask just to be sure. So we do empower our staff they don't need permission, they don't need to declare that they're sick, that if they're just feeling a little under the weather, when in doubt, wear a mask. And it's just to protect.
Nice,
Yeah.
Nice, good. Then the other big thing that we can do to protect ourselves and our families in the cold and flu season, of course, is the flu vaccine.
Yes.
We're going to do a very detailed recording for another time about the flu vaccine itself, but do you agree, as the infection control guru for us, that that's one of the most important ways? I know for our rheumatology patients and for our oncology patients, we recommend that the family completely, everyone get vaccinated for the flu, because that saves them from bringing it home to the child who could be anywhere from mildly immunosuppressed to completely immunocompromised. For me, I like everyone in my house to have the flu shot because I'm not immunosuppressed or compromised, but I don't like being sick. Correct. So will you talk a little bit about what the CDC recommendations are for flu shots and what we do here at Cure for the Kids to make sure that the staff are trying to protect our kids as well?
Oh, that's a great question. So yes, immunizations, like I was mentioning before, that prevention, if you can prevent the infection, you can't spread it. And so we do highly encourage all of our staff to get the flu vaccine. It actually is a requirement of working here to protect our very delicate patient population that we do have. CDC does recommend the flu vaccine for most people in the community. There are some nuances that people should talk to their doctor about if they are concerned, but widespread, it is safe. You cannot get the flu from the flu vaccine. It's an inactivated virus. You might get a little bit of achiness from just your immune system getting ready to build those antibodies, but it is a highly effective way to prevent. And even the preliminary data this season is showing that the flu vaccine is working against this year's flu virus. So it's fantastic. It's really encouraged.
Good.
Yeah.
Good. We hope that you found this information helpful here at Healthy Happy Hour. That is our goal, is to make sure you're getting the information you need and that we are there to be your education source. Thanks so much for stopping and seeing us today. We look forward to seeing you on the next episode of Healthy Happy Hour.
National